Hello everyone, good evening. Welcome to I Care for Your Brain with Dr. Karen Sullivan. That's me. I am a board certified neuropsychologist and I try to come to you every Wednesday at 6 o'clock Eastern Standard Time with a free brain health lecture, one that is based on scientific data and research and explains complicated things, hopefully in a clear way. Tonight we're going to be returning to our topic of essential tremor, and we're specifically going to be focusing on the unmet needs in this community. Somebody wrote me and said, boy, this one could be very long, Karen, and I agree. That's for sure. This is about our 6th lecture on the topic of essential tremor, and I have just felt so much support and love from you all as a community that I'm really excited to share with you a lot more information tonight about our webinar that we are planning. We opened up early registration late last night to the folks who had signed up for an email saying that they wanted to know more. And as I am talking during this lecture tonight, we're actually going to be opening up the public registration. So as we talk, I'm going to be sharing with you a little bit more about what we're going to do. So it is limited to 100 learners because we want it to be a truly educational give and take experience. So if you're interested, I would definitely recommend that you sign up soon. So the title of my lecture tonight, like I said, Unmet Needs in Essential Tremor. Well, I could have also called it Gaps in Knowledge in Essential Tremor, Gaps in Care as Essential Tremor. The longer I work as a neuropsychologist, the more I learn from people who are living themselves with the brain health disorder. The more I am convinced that neuropsychology is the very best vehicle that I know of to truly make a difference in someone's care, how they feel about themselves, the interface between the self and the symptoms. All too often, all brain health conditions can become very medicalized if you just stay within the medical system. Now, of course, the medical system gives us a ton of things that are super important, and I would never want to downplay that, but I also know that many times when you go to the doctor, the conversations involve the visible, the objective, the seeable. We talk about milligrams of medicine, we talk about new medicines, and there's not any real conversation typically about the you in the brain health issue. And so what I really care about is that we value the unseen, validate what our patients are telling us themselves, and embrace the subjective. We also, as neuropsychologists, are big believers in really caring about the adjustment to different neuropsychological issues. And so one of the biggest perks of my job is getting to hear from people how validating that these talks have been when they come to see me in my clinic in North Carolina. And people are just desperate for information. That is one thing I feel like I have really learned. So if you're lucky to get some little nuggets from your doctor, that's great. Of course, there's some that go into a lot of detail, and those of you who have those doctors are super lucky. But many of you have learned through Dr. Google, and unfortunately, there's a lot of product placement that goes along with brain issues, in part because I think they're taking advantage, exploiting the truth that we don't talk nearly enough at a high scientific level about the brain. So I really feel strongly that you deserve an in-depth explanation of your brain health challenge and what's going on. So if you've been watching me in the last 2 years here, you know that I believe there are many layers of dysfunction, disability, suffering in brain health challenges, and that a big one of those is a lack of access to good quality education and validation of the unseen. And that is really unacceptable. And I have some power over that. I have some control about that. And so that's how we really got together here on Facebook. I knew many of you would not be able to come see me in my clinic in North Carolina, might not even have access to a board certified neuropsychologist. So we really wanted to bring that information to you guys here. It's been going pretty good so far. So ET is a perfect example of what I'm talking about tonight. So there are so many questions. People have even been told that there is no other symptom in ET. It is a monosymptomatic disorder, and that's it. It's a bilateral action tremor, and that's it. Of course, we know, not true at all, right? So people have questions. Why do I have this? Maybe I don't even have a family history. Why, when I read about ET, am I not seeing the other things that I know I'm struggling with, the cognitive issues, the emotional issues, the adjustment issues? How do I develop a healthy relationship to what's happening in my brain without it feeling like me and my identity? So these are the questions that have really pulled me into the ET community, and I feel a really strong sense of advocacy develop in me over these last 1 to 2 years, because there's so much to be said about what happens in the brain of the person who has ET. So the way I've been thinking about it is really trying to organize my thoughts and then address the issues, right? Because I am kind of a complainer in life, but I'm not a complainer with no solution. So I am critical of things that I don't think are correct or right or done the right way. That's why I own my own practice, do things my own way. But also, if I'm going to criticize the way things are, I need to offer a solution. So I wanted to share with you all tonight the 4 areas that it seems to me where we are really failing our ET community. And this is exactly what we try to address in our June 26th webinar. So the first unmet need, I think, falls in the why and the what's. Okay, so why do I have this? Why did it start at this particular age? Like I said, some of you might have a family history, but there's sometimes people don't, and there's reasons for that. We have gotten better and better as diagnosticians, especially in the last couple of decades. And so you might have had someone in your family who had the shakes, or it was misclassified as something else, someone who was conceived of as having an alcohol problem, when in fact it really was genetic ET. We just didn't call it that. Some of you have never been explained what the brain basis of ET is. The connection between the hands or the head or the voice or the limbs has not been connected up with the cerebellum in the brain. Specifically, even the Purkinje cells, which we know that through GABA are the 2 things that unfortunately misfire and degenerate in ET. So there's so much to be said about just the specifics of the neuroanatomy of ET. There's also so much to learn that we classify as non-motor symptoms. And this one gets me because when people don't feel heard, they don't feel validated, you know what we do as human beings? We start to feel like there's something wrong with us. And I love that about neuropsychology, that we get to normalize and universalize the things that go along with that brain health condition, because that part of the brain doesn't just give you your tremor. It also does other things. And so going back to even 1949, when ET was first formalized as an actual clinical disorder, it has been mischaracterized since day one, as far as I'm concerned. So it has been thought to be a 1-symptom condition, bilateral action tremor, that's it. It was only 2 years ago, in 2018, when the Task Force on Tremor from the International Parkinson's and Movement Disorder Society acknowledged that ET needs to be modernized in terms of our scientific understanding if we're ever going to advance our care. So these group of experts that got together, they themselves said within movement disorders, ET presents the greatest challenge. And they weren't quite sure how to move forward, so they came up with kind of this waste paper basket concept of ET+, and we've talked about that in previous lectures. It's established to acknowledge that there are further neurological signs of unknown origin in ET. And the 3 that they've come up with that they call soft signs are mild memory impairment, impaired tandem gait, which means if you simply try to put one foot in front of the other and walk like that, you're going to get off balance and wobbly, and subtle body posturing that can be considered dystonic. So what is dystonia? It is when muscles contract in really uncontrollable ways and wind up giving us some twisty motions in different parts of our body, totally involuntarily. So these panel of experts basically said, we really don't have too much specifics. We can't go into more depth, but we want to make sure that the public starts to wrap their head around ET in a slightly different way. So I want you to just think about that. These are the world experts, an international panel of movement disorder neurologists, researchers, and they are saying we cannot agree on the true involvement of ET. So what do we expect people are going to get when they go to their PCP, when they go to their neurologist? Even some movement disorder specialists don't necessarily keep up on all of the latest literature in ET. And that's been so much of what has been my mission, is to pore over the research a lot and bring the things to you that I think could impact how you feel about yourself, how you feel about your ET, and how you can empower yourself through this information to have a better quality of life with ET. And it really speaks to the need for you to pursue your own educational options and not just wait every 6 months, if you're lucky, to go to the neurologist and see what thing they're going to share with you. So the reason we've really moved into this ET plus idea is that alongside patients being better and better advocates, feeling more and more empowered to talk about their total symptoms with neurologists. We've also had incredible advances on this part of the brain where we know ET sets up shop, which is the cerebellum. So over the last 20 to 30 years, the cerebellum has gone through a makeover, a glow up, as they say nowadays. It used to just be thought of kind of as this little part of the back of the brain that was heavily myelinated. We knew a lot went on back there, a lot of communication between brain cells, but we thought it was all to do with movement and motion and balance. There was no validation that it had to do with cognition, meaning the way you think, the way you pull information out of your brain, and certainly no idea that it had anything to do with modulating emotions. Oh my gosh, emotions in the cerebellum, that is like very modern way of thinking. So we now accept that the cerebellum is the great coordinator of everything the brain does. So the great coordinator of the smoothness of our starting and stopping, right? So remember last time we talked about how when you go to the neurologist and they put your arms out and ask you to touch your nose, what they're really looking for in cerebellar issues is what happens as we approach the target. So if we have shaking that's going on out here when the hands are kind of at rest, okay, that's one type of tremor, and we start to think about Parkinson's. But the cerebellum really kicks in right at that motion when we're almost there. So think about right when you go for the pen, right when you try to put the soup spoon into your mouth. It's like the moment of focus, the darn thing kicks in, and that's when we really see the bigger tremors in ET. We know that cerebellar injury, due to whatever cause, stroke, genetic cerebellar issues, ET, results in a disturbance of timing throughout the entire brain. So it's only been validated with the tremor, right? So I often think of the hands, that's the most common, but of course can be anywhere of the body. This has been so misunderstood that there is a whole population of you out there, millions and millions of people who might just think they're too emotional, or why are my relationships so complicated, or why does it feel like I have so much going on inside of me and it's invisible to other people. That is a burden to live like that, and we have to design educational programming to specifically target that, because we can remove a layer of suffering from this condition. So that's my first one, is that I don't think we're meeting the educational needs of people with ET. The number two one is that I do not think in any way we are meeting the social needs of people in the ET community. So this is rarely discussed, almost never treated. Very recently, the group at Yale, under Dr. Lewis's guidance, who's really the foremost academic researchers in ET, they have been doing work on the concept of embarrassment in ET. So this is such important work. It's so helpful to know what they've written maybe 6 or 7 papers on this, okay? So this means so much to me. You can see, right? I get enthusiastic. Is that my hope, and the way I try to do things in my clinic, is when someone is diagnosed with a brain health condition, the cognitive is evaluated and treated, the social is evaluated and treated, and the psychological is evaluated and treated. And I just know that there's so many of you who are just totally getting pushed aside on the social piece. So we do not live in a bubble, right? We are social animals. And the truth is that the tremor in ET is visible, and people react to it, and that affects you, and that affects the way we feel about ourselves. It affects the way your tremors worsen. And the worst part of all is that it maybe interferes with the way that you interact with the world. So you are less likely to accept social invitations when you have ET. You spend more time alone. There is a high rate of social phobia in ET. So what this means is you basically drop out socially, right? You get less and less comfortable in social settings, more and more attuned to other people's reaction to you, more and more concerned about what they think about your shaking. And basically, you now have an anxiety disorder called social phobia on top of having essential tremor. And I just do not think that there has been nearly enough knowledge and intervention put in around that topic. And I'm really excited to explore that in the webinar. The third one, I think, is the impact on self-esteem in ET. And this kind of goes back to the social piece. So when people are struggling with embarrassment, it's a vicious cycle, right? It typically doesn't just stay at a certain level. The more you avoid things socially and gatherings and barbecues and families, the harder it is to put yourself back into it, right? That's why so much of anxiety treatment relates to something called exposure therapy, which is the more you're out of practice, the harder it is to get back in. And so this is a very vicious cycle. And at the end of it is your self-esteem, how you feel about yourself, your confidence, your feeling of efficacy in the world. And I'm not saying that all of you feel this way, okay? But if you have ET and you've heard me describe this and you said, no, that's not me at all, I'm totally comfortable going out in the world. Well, I can guarantee it's because you've done some work on this. You have found some lines to say back to people when they stare at you or they make a comment to you. But not everyone is necessarily wired this way, and too many people are experiencing negative self-esteem as a result of their ET. So again, when we just medicalize brain health issues, we're missing these huge areas of opportunity to improve people's quality of life. So again, what concerns me is that very few of you are having these conversations with people, maybe with each other, and I'm just not privy to them. But I can tell you, it takes some coaxing when people come to see me in my practice to get them to think about how do they feel about the relationship that they have with ET, right? It's sometimes not even a slot people have opened up in their mind. So that is my fourth unmet need in ET is, do you have a healthy relationship with ET? And again, you might have never thought of it this way. If no one's ever asked you, you've probably never considered it. It's a ripe area of exploration. So I want you to think about two characteristics of unhealthy relationships. And I want you to think about if this relates to your relationship with ET, right? Because ET is not you. ET is something that's happening in your brain, and your person, your mind, your spirit is separate than your brain, right? So the first characteristic of an unhealthy relationship is a lack of communication. So this is a key cardinal issue in bad relationships. So without it, there's no foundation with which to build up. It happens when we don't talk about things, when we try to hide things, when we don't validate how we're really feeling. We try to avoid it on the inside, and we don't have an open dialogue about it. And I'm afraid people can't have that open dialogue if no one is asking them the right questions. The second characteristic that defines an unhealthy relationship is criticism. And this is one of the most satisfying areas as a psychologist to work with people. And we're going to be walking people through this in the webinar. You might not have ever thought of it this way, but you probably talk to your symptoms. And I want you to train that inner voice to think through, is that an accepting tone that you take? Do you choose accepting words, supportive words? Are you a cheerleader? Or is it a critical tone? Is it negative? Is it punishing? A lot goes on in the preconscious mind that dictates how we feel. And when communication is unnecessarily critical and harsh, it's a form of emotional abuse. And so why would we characterize our relationship with a brain health disorder any differently than we would with another living person? It's a living entity. It has a big impact on how we feel. We live through it every day. So it seems to me that even the most brilliant movement disorder specialists that I know, their expertise comes through again. And should you be on propranolol? How many milligrams should you be on? But true treatment of ET goes so much more beyond those things. So tell me if you think I missed any. I think those are the four biggies that I came up with, but I trust your experience to tell me that I got it right or maybe I got it wrong. So how am I going to act on this information, right? I told you I identify a problem, and then I think, what is within my control that I can do something about? Well, darned as I might, I have not yet found a way to change the healthcare system. I try in my own way, in my own practice, but what I do have total control over is what I offer you at I Care for Your Brain, right? So I can research till my heart's content, I can design presentations, I can access you all out there in the world and give you as much of that information as I possibly can. And so on June 26th, that is exactly what we're doing. We're gonna have a Zoom webinar, and the whole focus, 4 hours worth of content, is non-motor symptoms, okay? I'm going to open up the registration in a few minutes, and I want you guys to consider joining us. And so what's going to be really cool is I'm going to be joined by my colleague, Dr. Jenna Renfro, who works with me in my practice. She is a movement disorder specialist, and she brings a lot to the table. She really, really complements my expertise, and I feel really strong about what we can offer you when her and I join forces together. She's been here on I Care for Your Brain twice as a guest host, and she'll actually be with us next week talking about non-drug treatments of ET, which is a really cool topic. So some of you hopefully know me, but for those of you who don't, I am a board-certified neuropsychologist. I was on the faculty at the University of North Carolina School of Medicine before I broke off to the wild world of private practice. I finished my postdoc at the Boston VA through Harvard Medical School and have my PhD from Boston University. Dr. Jenna Renfro actually went to the same internship program as me at Harvard Medical School. That's how we met each other. And she completed her 2-year fellowship at the Movement Disorder Center of Excellence at the Medical University of North Carolina in the Department of Neurology. She went to the University of Florida, which is really a very top-tier school, for her PhD, and she is a specialist in something called acceptance and commitment therapy. And I'm going to tell you how that's going to serve you in a minute. So we're each going to split it down the middle. I'm going to do 2 lectures and Dr. Renfro is going to do 2 lectures. They're each going to be an hour long, so this is 4 hours, okay? I'm going to tell you a little bit about each of the lectures. My first one is called Essential Tremor is a Neuropsychological Brain Health Challenge, Non-Motor Symptoms Validated and Explained. And what I'm going to do is give you my very best description and understanding of ET, the cerebellum, the Purkinje cells, those age of onset questions, the course of your symptoms, really getting into the cognitive stuff. Why can't I come up with words quickly like I used to? And the emotional stuff. So why are my emotions feeling like they're a little bit hard to control? Remember the disturbance of timing with the cerebellum. Once you know this information, it changes how you feel about your symptoms because it makes sense and you don't feel like, what the heck? I cannot make sense of what's happening in my body. My second lecture is going to be on the social impact of ET, and I'm calling it How Your Symptoms Meet the World. And what I'm going to do is really try to get into that concept of embarrassment and think about the social isolation and how that interfaces with ET. I want you to understand why this is so concerning is because of the social basis of our brain, the social basis of our being. So we have to talk about socialization coping skills, why we need to educate the public so the reaction isn't quite as difficult, the staring, right? And really what I want to do is empower you how to do your part. We need to join together as an army and go out and be saying the same thing to the world so everyone gets better educated and they don't wonder why we're over there shaking. So then I'm going to switch it over to Dr. Renfro, and where I kind of take the lead on education and empowerment, I then toss her the football and she picks it up on healing and transformation. And I love what she brings to us because it's such important work and it doesn't nearly get the attention it deserves. So she really is an expert on the emotional issues that come along with ET. Knowing that you are not struggling alone is honestly a huge, huge gift you can give to yourself. She's really going to normalize the emotional aspects of living with any chronic medical issue, but specifically ET, and really explore that idea of what is your relationship to ET. Her second lecture is how to optimize your psychological quality of life with acceptance and commitment therapy. This is the coolest therapy approach. She's amazing at explaining it, and it's practical, helpful tips that anyone could use, but especially when you have an uncontrollable symptom and you have to still live a life according to your values, your preferences, the things that are important to you. The idea of this lecture is do not let ET stand in your way for anything that you want to do, whether it's be seen, make your unique contribution to the world. Sometimes the symptoms do keep us from doing that, but there are workarounds and there is coping skills and there are strategies. So between the two of us, I really feel proud about this program that we have put together. So you can watch it live on Zoom on June 26th, but you also get to keep the lecture and watch it anytime you want on replay. We're also going to send you our PowerPoint presentations after, and a lot of people ask me for those over these last 2 years, but the way I do them here, like right now I actually have my laptop, you can't see it, but I'm doing a PowerPoint and that's how I'm knowing what to say to you. I'm not that good that I remember everything, but they're kind of messy because I'm very busy in normal times and I try really hard to make them good, but these are going to be really top notch. And so that really gets us to something I wanted to just spend one moment on before we part ways, and It's kind of an obvious question, which I think is, okay, Dr. Sullivan, how is this the same or different from what you've been doing here on Facebook? Well, the approach is the same. Every time I've done a lecture in the last 2 years, what is in my heart is that I want to educate and empower you to the best of my ability. But there is one thing that has limited me for 2 years, and that is time. When the world is operating as usual, I am running a practice, I see patients full time. You know, I'm a wife, I'm a mother, I do a lot of lectures locally in my community, and I simply cannot go as comprehensive on these lectures. So one of the silver linings for me of this coronavirus has just been more time to think about how I can make perhaps an even deeper contribution to the brain health community. So it's the same high quality information, but really a lot more. I think if you've liked what I've done here, I would like to say that you would be very, very pleased with what we're going to offer you in this lecture. So what is different? So what is different is that when I offer you something here, it is free. I will be charging what I hope you think is a reasonable, affordable fee for the webinar series. We have a crew, very essential people that make all of this possible, and there are just costs that go along with doing these kind of things more formally. So I hope that you can respect that and feel that this information is worth your well-earned money. So the cost for the webinar is going to be $87, and that is about $20 a lecture. With the registration fee, we're going to be making donations to the International ET Society and the National Tremor Foundation. So we picked them because they're both really strong advocacy groups, and that is the key word. So if you go on www.icfyb/webinar ET, which I believe are in the comments here, you will get to go to the page, be reminded of what the lectures are, and see how you can register. So it's limited to 100 because, again, we want this to be a very high quality experience, and so we're anticipating that it's going to sell out. So if you're interested in having this deep educational, psychological, transformative experience with us, I really recommend that you jump on it and sign up today. So thank you guys so much. You guys are truly a wonderful community. I hope that in my small way I help. It's really a privilege to be with you every week, and if we have success with the webinar, my idea is to offer more and more of them, to really be able to carve out more time in my clinical schedule to devote to doing high level educational experiences, because I just know it makes a really big difference, and I'm afraid you're not necessarily getting that information elsewhere. So thank you guys so much. You guys are awesome, and I hope you have a wonderful rest of your day. Bye.